Welcome back to the Delaware Way. Christiana Care, who's on the show quite a lot. Many of the doctors and nurses here to talk about medical stories. They recently won a pretty prestigious award, the Eisenberg Patient Safety and Quality Award for its technology-based CareLink program. Here to talk about the award and what the CareLink program is Dr. Tabassum Salam, who is the medical director of Christiana Care and its CareLink program. Thank you so much.
Thank you very much for having me here.
Appreciate you being here. What is CareLink?
We are made up of nurses, social workers, and pharmacists. And our job is to guide the people we care for across the healthcare continuum. So put yourself in the place of a patient, and more than 50% of Americans have more than one chronic medical condition. If you're one of those people, let's say you have diabetes or heart disease or lung disease, it's hard enough coping with your illness. But layer on top the complexities of coordinating care between your primary care doctor, then your specialty doctor, getting yourself to the pharmacy to fill your prescriptions, remembering when your next blood test is due, remembering which med to take when and what it's for, and generally just coping with your general medical problems. You need a team to help you, and that's your CareLink team.
And how does CareLink come in? How does it work exactly? So I have these problems.
You do. We reach out to patients up and down the state of Delaware, and we're very proud of that we reach out to patients up and down the state. And we reach out in person, often knocking at doors, meeting them at their doctor's visits, or by telephone, to understand what these needs are. And that's why we have nurses. They guide patients by educating them about their disease, helping them understand what they need to do to take better care of themselves. Patients with complex lists of medications, sometimes conflicting lists of medications, they need a partner in that.
It is interesting that you have been able to link up all of these medical professionals under one tent.
Yeah.
Has that not happened in the past?
It hasn't happened in the past. We have hundreds of thousands, millions of earnest healthcare providers all across the nation. But until recently, most of us tended to work in our own little silo. Often, we have great rapport with our patients one-on-one within the confines of our office or the hospital unit we're working out of. But the minute the patient traverses from one care setting to the next, communication sometimes does break down.
Now, since you won this award, it leads me to believe this isn't being done elsewhere.
It's being done in small and medium efforts across the nation, but the reason we won the award is we've really shown how we've accelerated our work. We have a great team of professionals that I already mentioned. We've done a lot of networking and building of the connections across the state so we can support our patients between all of our medical colleagues up and down the state. We've also brought in a lot of information technology enhancements that help us be efficient in outreaching to patients.
Like everything nowadays, it has to be quantified.
Yes.
Everything has to be quantified.
Right.
How do you quantify this? How is it helping patients? How does it help Christiana Care?
The first thing is patients are happier. The second thing is patients are healthier. More patients are reaching goals such as getting their diabetes in better control. Another way to measure good control of your health is, are you using the emergency department less?
And the last part's important for the insurance companies and the hospitals because it ends up saving you money. I hate to bring that up, but it's always important.
And that's very important. That's also a tenet of our work is we need to be fiscally prudent. We need to make sure patients get the right health care at the right place, at the right time, in the right measure. We're not skimping on healthcare. We're not skimping on getting patients to get the care they need. If a patient needs a test, they get it. They should get it. If a patient does need a hospital stay, they should get it. But the point is, if we can get them healthier at baseline, they should reduce the unnecessary use of various sources of health care.
Well, thank you so much for coming in and explaining the award. It's a wonderful program. Dr. Tabassum Salam, Medical Director at Christiana Care, the CareLink program, Care Now. And that is the Delaware Way for this week. Go to www.kjwp2.com to replay segments from this show or previous shows, and leave your comments about what you've seen on today's show on our Facebook page, or reach me on Twitter at The Delaware Way or at Larry Menti. We may read your thoughts on a future show. I'm Larry Menti. See you again next week.